We're testing goniometry for the ankle. So to test dorsiflexion and plantar flexion, patient's going to be seated. Ideally, you want the table be higher so you could be in a low sitting stool. The fulcrum is going to be on the lateral malleoli of the ankle, and then you're going to be putting the proximal arm on the lateral aspect of the leg, on the lateral aspect of the fibula. You could use the fibular head for reference. And then the distal arm is going to be on the lateral aspect of the metatarsals. For plantar flexion, degrees, the end range should be firm. Dorsiflexion, it should be firm, and it should be 35, 30, 25 degrees. 20?
Yeah, just 20.
Oh, sorry, 20 degrees range of motion. And same landmarks for plantar flexion. You're going to bring the foot down, and for that range of motion, it's 50. So same landmarks going into plantar flexion. That's 50 degrees of range of motion. To test inversion and eversion, ideally you could use one of these because it contours better and it's more flexible. The fulcrum is going to be on the midline of on the anterior aspect of the foot between the two malleoli. The proximal arm is going to be on the anterior aspect of the tibia, and the distal arm is going to be on the second metatarsal, midline metatarsal, and then inversion is going to be firm end feel, and eversion is going to be a hard end feel. For inversion, degrees for range of motion is 35, and for eversion it's 15. So inversion 35, eversion 15, same landmarks. And then last but not least, we have inversion, eversion for the forefoot. You could have the patient laying on their stomach or prone with their feet hanging off the side of the table. You're going to be putting the fulcrum on the posterior aspect between the two malleoli, like so. The distal arm is going to be on the posterior aspect of the leg, and the distal arm is going to be on the midline of the calcaneus. Same again, just like we did inversion and eversion. Inversion is going to be a firm end feel, and eversion is a hard. For range of motion, there is no AAOS point of reference for eversion, but for inversion, it's 15 degrees. Oh, I'm sorry, 5 degrees, not 15, for the forefoot. And then you're just going to line everything up, and then you're just going to bring it slightly out. We got about 10 degrees for inversion, and for eversion, we could just test it. Yeah, we got a couple of degrees in eversion. And that'll be all. Thank you.